This is science for week 5. So we have here Smile Learners Packet, Science 1 SSES for week 5. Write your name before we begin. Introductory concept. There are activities that we do and there are accidents that also happen even if we are being careful. We need to learn how to apply first aid treatment while waiting for the help of our community health workers or medical specialists. In this learning packet, you will be able to learn the first aid treatments in common accidents. For our learning competencies, this is based on the milk. At the end of this learning packet, you should be able to demonstrate how to apply first aid treatment to common accidents. We begin with our pre-test directions. Here are some. Let's remove this word. Here are some of the common accidents that usually happen. Another correction naman. Usually happen at home and in school. What are the things which we need to do? So, ano mga dapat pang gawin if ever we encounter these accidents? Put a check on the correct statement. So, there is a common question, what do I need to do? First, for bruises, o yung lata, o yung mga pasa. So, usually this is, we usually get this pag nabubunggo, nakakatama sa kanto. So, yan yung mga nag-violet ang skin na minsan nagre-reddish. Okay, so what should be done if you got bruises? Apply pressure to stop the bleeding and apply an antiseptic to the area. Or, apply cold pack. For bruises, what should be done? Apply pressure to stop the bleeding and apply an antiseptic to the area, or apply cold pack. Next, for page 2, continuation, what should be done for cut or scrape, mga galos, gasgas, or mga sugat. Simply, sugat, anong gagawin? Apply pressure to stop the bleeding and apply an antiseptic to the area, or apply cold pack. Again, for cut and scrape, what should be done? Apply pressure to stop the bleeding and apply an antiseptic to the area, or apply cold pack. Next, for sprain, yung na-overstretch ang muscle or may mga naipit na, ano yan, minsan sinasabi naipit daw na ugat. For sprain, what should be done? Wash my wound with water and soap or apply cold pack. Again, what should be done for sprain? Wash my wound with water and soap or apply cold pack. Next, what should be done for swollen forehead? Yan, bukol. Wash my wound with water and soap or apply cold pack. What should be done for swollen forehead? Wash my wound with water and soap or apply cold pack. Then, if you're done, let's proceed with analysis. Directions. Choose the correct statement from the box to answer the question, what will I do? Those statements in the box are ways on how to demonstrate or apply first aid treatment for some common injuries that usually happen at home or in school. So there are choices in the box. What are these? First, wash the wound with clean water and soap. Next, applying cold pack. And then the third one, use cohesive bandage for support and see the doctor. So these are the choices to be written on the next page. Okay, for number 1, you can get bruises when you often bump or fall your body against things as you walk and run. What will I do? So you are to choose from the box, dyan sa tatlo, and then you are going to write this on the blank. So you can flip flip the page back to page 2. And then, pause muna para you can finish number 1. For number 2, what will I do? You usually get wounded on the knee when you become careless when playing. Yung nadadapa. You bump or fall your body against things as you walk and run. What will I do? Again, you are going to choose from these 3 statements. Pause to finish number 2. Number 3, you can experience foot sprain while playing football. So, yung parang napipilay na natitipalok. So, you can feel the pain and it commonly happen when your ankle was twisted or torn. What will I do? You have to choose from the box. Again, among these 3 statements. Pause to finish number 3. On the next page, number 4, a sudden forceful blow or bump on the head might cause swollen head or forehead. What will I do? Because there are 3 choices, there are only 3 choices, it means that there is one statement which will be used again. So, one answer will be repeated for the next item. So, para sa bukol, what should be done? Pause to finish number 4. And then when you're done, let's proceed with abstraction. Okay, for abstraction, why do we need to know how to apply these first aid treatments? Give 3 reasons. Bakit ito kailangan natin malaman? What should be done or the first aid treatments to common accidents? Bakit? So you need to state 3 reasons. If ever you have the idea but you don't know how to write it yet, so you can ask from the adults, or you can use short statement or phrases only. So, bakit kailangang malaman ang first aid treatment? Pause to finish writing the 3 reasons. And now, let's proceed with the discussion. Okay, for the discussion, remember this. Here are the ways. Palakihin ko lang. Here are the ways on how to demonstrate. I-correct ko lang. May mga grammar error lang. So, here are the ways on how to demonstrate or apply first aid treatment to common accidents. First is sprain. Sprain is when a ligament which connects parts of a joint is stretched, twisted, or torn. So, yung sa Bicol, nababaliko. Pag halimbawa, nadadapa, yung wala namang sugat pero parang pilay-pilay ka na. So, probably it's a sprain. So, what should be done? Apply a wrapped ice pack, so yellow. And then, apply a supportive bandage para hindi magagalaw. So, minsan din tela, or halimbawa, meron na kayong bandage sa bahay, then you can use that. And then, if it becomes swollen or still it hurts, so get help from adult. Take him or her to the doctor or the emergency room to have him or her examined. So, baka kasi it needs to undergo x-ray. So, kailangan first aid treatment para mawala muna yung sakit, pero i-anticipate na baka merong serious na damage. Okay, for number 2, bump on the head, a sudden or forceful blow, impact, or jolt on the head. Bukol, kumbaga. So what should be done kung may bukol? Wrap an ice pack or a bag of frozen vegetables, basta anything na malamig, in a thin towel and hold it against the area to reduce swelling. So yung mga malamig, it will reduce swelling. So baka eventually, mawawala na yung bukol. Basta ang bukol, walang sugat. So just a bump. And then, get help from adult, take him or her to the doctor or the emergency room to have him or her examined. So usually pag malala, may mga ano na yan, may mga tear na yan sa skin. So it makaseryoso. So hindi ilang bukol ang gagamutin. And then for number 3, cuts or scrape. Any cut means that there will be some blood. So dahil kumbaga may tear sa skin, so probably may lalabas na blood. So, should you be scared? Iiyak ka ba ng malakas? At pag umiyak ka ba ng malakas, hihintog ba yung pagdugo? No. So, what should be done? You need to apply first aid treatment. And it does not include crying. So, there will be some blood, expect na some blood, but this can be one of the most difficult things involved in first aid for children. Kasi, bakit mas mahirap ito sa bata? Kasi, may mga bata na nasanay na whenever they see blood, nakakatakot yon, which is very natural naman kasi our body may veins all over, tapos syempre pag may nakatin na tissue or skin, may lalabas talagang liquid, which is blood. So what should be done is wash the wound with clean water and soap. So para kung ano man yung duming pumasok doon, kasi open wound, so mahahugasan, maaalis. And then apply pressure to stop the bleeding and apply an antiseptic to the area. So why should be applied with pressure? Yung didiinan lang, kasi may power din ang ating skin. They can heal by itself. Kagaya ng sa blood, may makikita ka niyan. Pero when along the way, yung blood, hihinto naman kasi ang blood may component siya na pampastop. Parang may seal, parang may sarili siyang glue na kapag nalinisan na, naalis na yung dumi sa sugat, so it will eventually stop from bleeding. So wag lang magagalaw. And then apply an antiseptic. So what does it mean? Ito yung example nito is the betadine. So, betadine solution. So, it will help in healing the wound faster. Kasi parang nasisil siya. And then, antiseptic na kakagamot din. It will, kung ano man mang bacteria, so, tama ba? Antiseptic, parang tulong na din, aside from you wash it with soap and water, makakapalinis pa din. So, that's it. So, bruises, for cuts or scrapes pala, pag gasgas lang, you don't need to cover it. Pero, if you need to go outdoors, para hindi matapuan ng langaw, then should be covered. Pero, it is recommended that it should para mag-dry siya agad, so dapat wala siyang cover, wala siyang band-aid. So, but for cuts, yung mga open wound, para kung nakabukas, para masil pa din siya, so it should be covered with band-aid or anything na gauze bandage, pwede rin yun. Okay, for bruises, a break in the overlying skin. Most bruises are not very deep under the skin so that the bleeding causes a visible discoloration. So, ito yung mga pasa, kung sabi ko, lata. So, what should be done? Just like the bukol, apply cold pack. And if there's a great deal of contagious pain, so masakit pa rin, or movement of a limb is very restricted or impossible, once again, seek professional help. Professional help should be sought. Pero bihira lang ito kasi usually ang pasa, lata or bruises, nawawala din yung parang discoloration lang. Una, magiging na siya, parang yellowish na violet, and then magiging yellowish, may red. So, para kasi yung dugo na hindi nakalabas. And then, habang patagal niya, naging violet. And then, soon it will be none. There will be none. So, hindi na siya magiging visible sa skin. So, that's it. So what are the common accidents? We have sprain, bump on the head, cut or scrape, bruises. So, yan yung mga palaging na-encounter ng bata. Ngayon na, syempre, hindi naman pwedeng bawal maglaro para hindi ka masugatan. So, because you should also enjoy. And then, pag nasugatan, now that you know some of them, and then now that you know what to do, so hindi na kailangang umiyak, magtatawag sa mama ng malakas na malakas. So, meron ka nang pwedeng gawin. So, aside kasi you are being careful, so meron ding mga times that you would encounter these accidents. Okay, in my previous lesson, so I presented some of the common accidents, and then may ni-reduce na siya. So I'd like to discuss this more to you. So ito, I'll show you. Okay, so ito naman, which I used yung may face-to-face pa kami. Okay, so we have first burns, hindi ito included, pero also kids might encounter burns. Sunburn is included for this, or yung mga paso. So, sunod, cuts, and then scrapes, yung gasgas. Next, yung bruises, pabukol. So, I'd like to share some points not mentioned in the module. So, what is first aid? So, we all need help at times in our lives. We all have accidents now and again, and we all get hurt. So, hindi na, kahit maingat, still we might encounter them. And when we are injured or suddenly unwell, what we want and need is someone to help us, someone who knows what to do. So alam na natin, we need to go to see the doctor, we need to go to a clinic or hospital, pero dapat may gagawin pa kasi hindi agad makakapunta, hindi agad magiging available ang doctor. So we should be aware of what to do, which is called a first aid treatment. So first aid is all about helping in people in situations like this. So, pwede ba rin to because you know, you can also help kids who might encounter this. Okay, so let's begin. So, how first aid works? Ano ba, bakit ba ito ay kailangan? So, it is a help given to a person who has been hurt or is suddenly taken ill. So, first aid are the steps you can take before a person gets expert medical help. So, bago man mapunta sa doktor, may ginagawa na. No? So, that's why it's called first aid treatment. But, it does not mean na first aid treatment lang ang gagawin. So, kasi there are serious accidents na kailangan na ng medical help or you have to see a doctor. So first aid can sometimes save a person's life, but more often it is help given in an everyday accident or illness. So kahit sa bahay, may baka may mangyari, so this would help. Okay, so first for burns, mga paso, alimba nakahawak ng mainit na kaldero sa oven, na hawakan mo. So, what should be done is run cool water over the area of burn. So, paano lang siya? Palamigin lang. So, you don't need to put toothpaste kasi ang toothpaste baka may irritant pa siya. So, it will give a cooling effect pero baka may component ng toothpaste na it would darken the skin or it would not help in the healing. So, just cool water, okay na yon for burns. Okay, next. So, treatment for burns, run cool water over burnt area, gently clean the injured area. Mahapdi yun, so you don't need to rub it. So, gently dry, apply antibiotic as silver sulfadiazine. So, ito yun sa mga serious na burns. Pero pag halimbawa paso lang na namula lang, so ganun lang pwedeng gawin. And then use a sterile bandage, cover burns, for serious burns, and take tetanus vaccination if required. So, kasi minsan, pag serious burns, may ano na siya, may damage na sa skin, so pwede nang mapasukan ng dumi. So you need to take anti-tetanus vaccination. Okay, next, for cuts and wounds. So yan. So what should be done? To stop the bleeding, apply pressure, that's what I have mentioned earlier, to the wound with a clean cloth or tissue. If possible, elevating the wounded part above heart level slows down blood flow. Kaya, sa mga nasusugatan sa paa or the lower limbs, mas madugo doon kasi mas nasa lower part siya, no? So to avoid infection, the main concern in dealing with wounds of any kind is infection, and the best way to do is to clean the wound and keeping it clean. So after cleaning it with soap and water, so make sure that it doesn't get dirty. So hindi papatapuan ng langaw, hindi paalikubok-kabukan, kaya iiwas ka muna sa maduming mga lugar. Okay, next. For bruises, yan. I think this is the least serious among the common accidents. So what should be done? So most bruises vanish in 2 weeks' time. So naalis lang naman talaga ang mga pasa, lata in Bicol. No bandage required if skin is not broken. So kung lata lang, yung skin lang nag-discolor, so okay, just leave it without anything to put on. So keep bruised area raised, apply cold compress sa incident mismo right after having it. So 1/2 hour to 1 hour at a time. So continue this for 2 days. So para lang kumbaga hindi na mag-discolor pa. Next, for sunburn, yung mga paborito ng bata when they go to the beach, minsan hindi na mamalaya na sunog na pala ang skin. And then, when they get home, mahapdi na yon. So, that's what you call sunburn. Mahapdi na kasi parang napasok ka na din. Okay, so what should be done? For sunburn, get out of the sun. So, kasi if you still stay under the sun, it will continue to be, to be hurtful. So, cover the exposed area. Take a cool bath. So, kasi makakapapress ko yun, malilesen ang hapdi. And use a cool compress. Apply aloe-based solution. Oo, yung mga Jeju aloe, yung nauuso na pampaganda. Pwede yon for sunburn. Okay, kasi aloe vera, it repairs skin. So, avoid using oils, bath salts, perfume lotions kasi ito, mainit ito sa skin and magiging mas mahapdi pa. And avoid scrubbing or shaving. Syempre, mahapdi yun. And then, use a gentle towel. Stay out of the sun while sunburned. So, don't worry. After naman to, siguro a week, or less than a week, mag-start na siya mag-peel. Kasi yung nasunog na skin, it will start to peel kasi may new skin na siyang being replaced. Okay, next. Ito naman yung mga serious na mga accidents. When foreign object gets in the ear, so ang unang gagawin, ayan, mga mahilig kung mag-experiment ang bata kung anong ipapasok sa tenga. So, you need to seek help from doctor. Kasi baka ganyan, for this illustration, yung dulo ng pencil, baka naiwan na sa loob. And then, in cleaning your ears, you need to ask help from adults. So, yan. Serious na to. Kaya you need to see the doctor. Okay, next naman, when foreign object gets in the eye, so, halimbawa, napowing, o kaya may natamaan yung mata mo, so, flush the eye with clean water to remove foreign objects para makasama na siya. Okay, you don't need to rub your eye, kundi yung covering ng eye, pwede siyang ma-scratch. So, madadamage palalo. Next, foreign object in the nose. So, meron din ganito mga nangyayari. sinusubukan isiksik kung saan, sa ilong, sa tenga. So, what should be done is you need to see a doctor. So, kagaya nung napanggit kong medical specialist, EENT, so yan ang sa kanilang specialization. So, you need to see the doctor again. Okay, next for nosebleed. Usually this happens kapag sobrang init o kaya minsan pag natatamaan ng ilong pag naglalaro. So it will cause nosebleed. So what should be done? So head tilted forward, hindi pa patingala. So next, squeeze firmly above nostrils and then eventually mag-stop na yan from bleeding. So, ayan. So, you need to seek help from adults and this should not be done. So, usually, ito yung turo noon at magtitingala para yung dugo pumasok. So, hindi naman pala, hindi yon tama. So, dapat tilted forward tapos naka-squeeze ang nostrils. So, that's what should be done in whenever you or if ever you got nosebleed. So, hindi naman sa nag-i-English. Nosebleed yung hindi joke. Yung tunay. Nagdudugo ang ilong. Okay, that's it for the first aid treatment. Let's go back to the module, etong learner's packet. Let's now proceed with application. Directions. Arrange the sentences below from 1, 2, and 3. The proper ways to apply first aid treatment to the common injuries that most children experience. So we now have 3 statements. Anong unang gagawin? What should be next? And then what should be the last step to be done? Okay, let's begin with number 1. When you got cut or scrape, anong unang gagawin? So these are the choices. Wash with clean and running water. Let it dry. Put antiseptic such as betadine solution. So, anong unang gagawin dito? That should be marked as 1, 2, and then 3. The last step. Pause to answer number 1. Let's proceed for number 2 if you're done. For sprain. So, yan. Anong unang gagawin? Get help from adult. Take him or her to the doctor. Apply ice pack with wrapped towel to protect skin. Apply a supportive bandage. Get help from adult. Take him or her to the doctor. Apply ice pack with wrapped towel to protect skin. Apply a supportive bandage. Number 3, for bruises, get help from adult. Apply a wrapped ice pack. Ulitin ko. So, it needs 1 and 2 na lang. For the first blank, get help from adult. Second blank, apply a wrapped ice pack. When you're done, let's proceed to the last page. Congratulations! Wow! Congratulations for finishing this module. Doodle or make a statement about what you learned from the topic. So, you can illustrate ano bang natutunan mo now that you know the first aid treatments. And then, or you can make a statement. So, it's only just 1 sentence dito sa loob ng parang chalkboard or whiteboard. So, what's next? None. We're done with science. Goodbye.